that is present in your medulla oblongata. Medulla oblongata present in your brain. It can moderate the cardiac function through autonomic nervous system. It moderates the heart function through autonomic nervous system. Neural signals through the sympathetic nerves, that is the part of ANS, autonomic nervous system, can increase the heartbeat, the strength of ventricular contraction, thereby cardiac output. Okay. Neural signal means sympathetic nerves, they increases the heartbeat rate, the strength of ventricular contraction and the cardiac output. On the other hand, the parasympathetic neural signal, okay, opposite of sympathetic is parasympathetic actions, means the actions governed by the sympathetic nerves are opposed by the parasympathetic actions, means जोटा बढ़ी थिबो sympathetic action रे सेटा decrease करिवो parasympathetic the action रे. कौन रहिला? The parasympathetic neural signal decreases the heart rate, the speed of conduction of action potential and thereby cardiac output. However, these are the neural control. Hormonal control is the adrenal medullary hormone acetylcholine, mainly acetylcholine, that increases the cardiac output or regulates the cardiac output. Last but not the least, some disorders associated with the circulatory system. Okay, there are various diseases related to your circulatory system, and some of the important diseases are high blood pressure known as hypertension, coronary artery disease, that is the CAD, angina, then heart failure. Let us know. High blood pressure is also known as hypertension. I have already told you what is high blood pressure, means deviation from normal blood pressure. जदि 120/80 जोटा रहबा दरकार सेठू any deviations, means more than 120 and more than 80. If that is more than 140/90, then we say blood pressure is higher. In this measurement, 120 mm of Sg or mercury is the systolic or the pumping pressure, and 80 mm of Sg is the diastolic or the resting pressure. If the repeated checks of blood pressure of an individual is 142/90 or higher, it shows hypertension. High blood pressure leads to heart diseases and also affects the vital organs like brain and kidney. So, for this cure, regular medication, avoiding tea, coffee, alcohol, regular exercise is very important. Then come to coronary artery disease, that is CAD. It is often referred to as atherosclerosis. Atherosclerosis means it affects the blood vessels that supply blood to the heart muscle. The blood that is supplied to heart muscle is affected. Okay, the blood vessel is affected. It is caused by the deposition of calcium, fat, cholesterol and fibrous tissue, which makes the lumen of the arteries narrower. Due to narrowing of the arteries, the flow of the blood will be reduced. That is called atherosclerosis. Another term is arteriosclerosis. You may get confused that. Don't get confused. Atherosclerosis means the narrowing, and arteriosclerosis means the hardening of the blood vessels due to deposition of calcium, cholesterol, due to growing age of human being. Then come to angina. Angina is also known as angina pectoris. A symptom of acute chest pain appears when no enough oxygen is reaching the heart muscle. If enough oxygen will not be available to heart muscle, it will not beat properly. Angina can occur in men and women of any age, but it is more common among the middle-aged and elderly. Okay, it occurs due to the conditions that affect the blood flow. Last but not the least, that is your heart failure. What is heart failure? It is the state of heart when it is not pumping blood effectively enough to meet the need of the body. If heart is not able to pump enough amount of blood, we say that heart failure is occurring. It is also called the congestive heart failure. Congestive heart failure, why? Because the congestion of the lungs is one of the main symptoms of the disease. Due to congestion of the lungs, the blood is not pumped by the heart properly. Hence, the heart failure occurs. Heart failure is quite different from cardiac arrest. Cardiac arrest कौन? When the heart stops beating. जेतेबेले heart रो beating बंद हबो, that is called cardiac arrest, and it is also different from heart attack. Heart failure, cardiac arrest, heart attack. Heart attack means the heart muscle is suddenly damaged by an inadequate blood supply. Due to inadequate blood supply, the heart muscle is damaged. Okay, that is called heart attack. So what is the difference between heart failure, cardiac arrest and heart attack? Heart failure means the congestion of heart, means heart is not pumping adequate amount of blood. Then heart attack is when the muscle is damaged due to inadequate blood supply. Then cardiac arrest means jetebale heart will stop beating. Okay, how hence we must take care of our heart properly. We must maintain our proper diet, proper healthy diet, regular exercise to improve our heart health and also the health of various internal organs of our body. Okay, so we have discussed all the concepts that is related to your heart. Now the sole thing you have to do is just to go through the topic properly and prepare yourself for your future examination and know your body properly for your own interest. I hope you all have understood the topic and love this topic and keep learning. Thank you all.